All right, everybody. Happy Thursday to each and every single one of you, and welcome to the Compliance Guy Live. Thank you so much for tuning in, logging on, and just hanging out with me and my special guest as we talk about the Provider Relief Fund today. And we're going to be getting into HRSA and talking about a few other things. Today, joining me is somebody who needs no introduction. She's been a part of the program several times in the past, and she's not only just a brilliant attorney and a great human being, she's one of my really good friends. So, Amanda, welcome to the program. Thanks for being here today. And I know we got a lot that we want to talk about.
Sure. Thanks for having me, Sean. I always love being on your show.
Well, we'll see if you feel the same way as I tell everybody at the end of the show. So hold on tight. So real quick, before we jump into all this stuff, for those of you that are, like I said, tuning in, logging on, and hanging out with us, a few things to keep in mind. We are streaming on 7 different streaming platforms. This will be recorded so you can listen to it at a later date and time. And we will also have this out on more than 80 podcast platforms. You can submit this to a number of different organizations for your continuing education. But again, make sure that you are in compliance with the terms and conditions and the requirements of those credentialing bodies to ensure that what you submit is in line with what they require to be able to issue the continuing education or continuing legal education units for this podcast. But it's been really exciting to see the number of professional organizations that are getting behind us and willing to offer continuing education to the folks that are tuning into these programs, because, you know, people like you, Amanda, are adding significant value from both a regulatory compliance standpoint and a legal standpoint. And I think that's what's really being appreciated. So thank you for helping to keep this program running the way that it's been.
Absolutely. Happy to share knowledge. And, you know, we're all in this together. I feel so bad for providers because it seems like we're getting hit, or they're getting hit from all angles. And so anything that we can do to help simplify the education and get the information out to them and give them tools to help them comply, or give them tools, like in this case, how they can use their provider relief money or other avenues from which they can get grants and other funding available. Happy to share knowledge. Hopefully we get to a point where, you know, clients are calling and we're able to give good news and we're able to get back to, you know, having some more constructive projects versus just putting out fires and talking about COVID. So.
Yeah, I know. We're all getting a little bit tired of talking about it, but it's not going away, and it seems like it's going to be hanging around with us. Folks that are live with us on the podcast program today, I have turned on the chat feature, so please feel free to post your questions, and Amanda and I will address those as quickly as we can. So today we're talking about the Provider Relief Fund, and for those of you that know what it is, or for those of you that have heard about it but aren't completely sure, this is a program that actually was designed to support healthcare providers in the battle against COVID-19 and the pandemic that we have been in now for almost 2 years. Now, through the Coronavirus Aid, Relief, and Economic Security Act, this is called the CARES Act, and Amanda and I were kind of chuckling about this a little while ago. She's like, well, what do you want to talk about? And I said, anything that you want, because there's so many different things that tie into, to use Amanda's term, this tangled web, right? But you have other programs that have also been part of this, which is the Paycheck Protection Program and the Healthcare Enhancement Act, which is PPPCHEA, the Coronavirus Response and Relief Supplemental Appropriations, which is the CRRSA Act, and the American Rescue Plan Act of 2021. So again, the federal government to this point right now for the Provider Relief Fund, the PRF, has allocated $186.5 billion in payments to be distributed through the PRF. Now, there's a lot more funding that has been provided for coronavirus and the pandemic to the tune of approximately $282.5 billion. And a little bit later on, we can kind of get into breaking down how some of that money was allocated and where it went to. But I want to focus, as I know you do, on HRSA and the PRF, so that we could talk about the looming deadline tomorrow, and then the grace period that kind of ends at the end of the month of November. So let me pause for a moment, Amanda, and let me turn this over to you, and let's kind of start where you want to kind of break this thing down and put
Sure.
it into perspective.
Sure. So when I talk about the provider relief funds, I always start with the CARES Act and going back to the statutory language, because we are never going to be able to change the statutory language. And to your point, Sean, the provider relief funds were issued to kind of help providers during this pandemic. And so the provider relief funds can be used by providers for COVID related expenses and lost revenues attributable to COVID. And so I always say, these are the only two things that you can use the provider relief funds for, and that's not going to change because it's written in the statute. What's interesting and what's frustrating for most of my clients is that this was originally touted as a no strings attached. And so it was, we got to get this money out to providers as fast as we can. And so any Medicare fee for service provider woke up one morning in April and saw that they had money automatically deposited in their bank account. There was no application. They didn't have to go on and apply for these funds or meet any other eligibility requirements other than the fact that they had 2019 Medicare fee for service revenue. So for many groups, for many providers, it was welcomed, right? Because we were just starting the pandemic. Things were starting to shut down. We were worried about how we were going to make payroll in some instances, how we were going to pay rent, get supplies. And so the money was definitely, the providers used it. But I had some providers that were no longer doing business. They had retired. They had sold their practice. And so, essentially the government was building the plane as they were flying it. And I say that about a lot of different programs that the government has done during COVID and or during this pandemic. Nobody's fault, right? We're human and we're trying our best. Everyone's just trying their best. So no program is perfect. But the issue with the provider relief funds is that more money became available in different phases. So we had different rounds, different phases. We had terms and conditions. We knew we had reporting requirements, and we didn't think that we did. Those kept changing. Deadlines kept getting pushed back. And so now I think we've got the hang of this provider relief fund thing. The first use period expired June 30th of this year. The deadline to report is fast approaching November 30th. So just a couple weeks away. So I think we have the hang of it. But I think what's frustrating is that we still continue to have FAQs issued, well into October. And that leaves many providers frustrated because it's, there's still a lot of gray areas. And it's like, well, are the rules going to change on us again after these deadlines have already passed?
Right. This is the thing, right? So from the very beginning, I'm not just a consultant, right? I am actually the chief compliance officer for a number of very large organizations, as well as a few, mid-sized physician groups. And when all of this came about, we were scrambling, trying to figure out, what, to your point, I had providers calling me and they're saying, Sean, the federal, government just deposited $150,000 into my account, or they put, $5,000, or they put $1 million. I had a client that had $1 million put into their account. Mm-hmm. And, there was no rhyme or reason at that point. Right. And I think you're right. We wound up flying an airplane without actually looking at the blueprints for, how we get this thing up into the air. And we've just been kind of at each phase figuring out what it is that needs to be done. And it's cost some of our providers. One of the first things that I told all of the providers that I work with, and I know I put it on my blog, and you and I have talked about this a tremendous amount. Any of that HHS grant money that you received needs to be put into a separate account. Mm-hmm. And until they actually tell you how to attest to it, and until they clarify the rules, don't touch that money. That money should be the very last thing that you ever touch until we have final clarification. So, For the folks that have not had a chance to work with you, you've been instrumental for the NSC HBC, for the listserv, for your own clients, for our clients. BMD has done a masterful job of putting out a tremendous amount of timely, authoritative, and accurate information. And, that's why you and I having this conversation today, as we're approaching the deadline tomorrow and then the end of the grace period on the 30th, is so critical for people to be able to understand, because there's so many questions that are still existing out there right now. And I'm sure we're probably going to get some additional questions as we're talking about this. So
Absolutely.
let's keep going.
Absolutely. So, as much information as I give out, I get more back. So it's all about, we're all in this together. That's the beauty of, our relationships. Healthcare is it's a small circle. And so I think it's really important to continue to give back and support each other. So I'm happy to answer any questions about the provider relief funds, especially with the deadline approaching in a few weeks. Probably most of the questions that I get are around, how do I quantify expenses? And then not so much on the lost revenue, but, the definition of patient care revenue. But the questions that I get around expenses are, well, what qualifies as an expense? And unfortunately, I go back to the statutory language of, COVID-related expenses. So it's up to the provider. The burden's on the provider to show that the expense was used to prevent, prepare for, or respond to COVID-19. And the government doesn't do a great job of giving you examples or saying, yes, this is a valid expense. No, this is not a valid expense or a reasonable expense. So the burden is on the provider to show how it was used to prevent, prepare for, and respond to COVID-19. So there's two schools of thought. The two schools of thought are, one, this is either a new expense, one that we didn't have pre-pandemic, or
Right.
it's an incremental increase in an existing expense. And that's due to COVID. I bought PPE in 2019. Now I'm buying 5 times more in 2020. And so it's that incremental increase. That's the school of thought that I live in because I'm conservative and I never want to be overreaching, especially, to your point, Sean, until we have clear guidelines of this is okay, this is not okay. I'm always going to err on the side of being conservative.
Right.
But there's another school of thought that says, well, I have to have space to be able to see patients. I have to employ people to see patients. I have to have insurance to see patients. And I think that's risky, in my opinion, because we don't have any guidance that says, yes, your overhead is, that you can use these provider relief funds for overhead. There's nothing definitive out there. And the guidance that we have, whether it's for this program or for the nursing homes, they received extra money for, quality enhancements and testing and infection control. All of the expenses or all of the examples that they provided are really, new personnel or additional expenses to retain personnel, new expenses to, an increase in your cleaning supplies, an increase in your PPE, all points to new programs. So new expenses or incremental increases. I don't have any guidance that says your overhead that you would have incurred regardless is an expense that you can use the provider relief funds for.
Right. Let me ask you, so because I know there were a ton of questions, and I still see some of these questions being asked. I think a lot of the attorneys have done a good job that have, gotten familiar with the provider relief fund. I know a lot of CPAs that have been giving some really sound advice on this, but I still see questions coming in about, can I use this money to compensate myself as the owner of the organization? Can I take any of this money as a bonus? Where are the limitations? You're talking about, what can I use the money for, right? With the increase in PPP supply or PPE supplies, some of those things, rent. But where are the areas that I cannot use this money? Can I use it to compensate myself if I'm an owner of an organization? Can I use it to compensate myself under a bonus structure? How does that work?
So that's a good question. And the answer is no. But I've known some providers that are like, I'm giving myself a bonus. I haven't taken a paycheck in 6 weeks because, I shut down. And so I'm not giving myself a bonus. I'm not giving myself a paycheck. So I'm going to take this money. I'm an owner. It came into my company. I'm an owner. The rules say, no, you can't use this money for distributions to owners, whether it's an LLC or a corporation. So that would not be permissible. And there are also some nuanced rules around salaried administrators, giving them money because they are spending so much time on COVID. There's an FAQ on this. It says, look, you can't pay your or you can't use the money for your salaried administrators if it's just a lost opportunity. They could have been working on this project, but they were too focused on COVID compliance or
Right.
anything related to COVID. It has to be a tangible cost, not just a lost opportunity cost. And so I think that guidance is pretty strong, and that they don't want it going to line someone's pockets.
Yeah.
They want it to be a tangible expense. And again, you have to show how it's related to COVID and how it impacted the organization.
Are the requirements for attesting to the money and how the funds are being distributed or allocated, is there a difference between a physician in solo or small group practice, or even a large group, 20 providers, versus a hospital network versus an integrated delivery health system where you have 5,000, providers? Is there a difference in how this money can be allocated?
Well, I go back to the statutory language of it can only be used for COVID-related expenses and lost revenues attributable to COVID. I think that the record-keeping requirements get a lot more burdensome depending on the size of the provider. So a solo practitioner is probably going to be able to say, yep, these are my expenses. My bookkeeper was, keeping track of all of these. I kept that in a separate bank account. And these are my lost revenues. Because my patient care revenues are very easy to identify and quantify, and I can compare them year over year. That's going to be pretty easy. And their backup documentation is going to be pretty easy. But when you get to a health system or an integrated delivery system, you get into a situation where you have multiple EINs. So the money
Right.
was distributed by EIN, by tax identification number, also known as a TIN. So the money was distributed by TIN, and then you've got parent subsidiary relationships, you've got related or affiliated companies. And so untangling that web, figuring out, okay, how is the money distributed out, and what is a permissible use? Because parent companies can distribute the money to subsidiaries, but you could be in a situation where subsidiaries received money, and then they're going to have a reporting obligation under that TIN. So it does get a little complicated. I've seen a couple of complicated structures, but I think for the most part, if you received money, if you've got parent subsidiaries related, it's probably easier just to separate it by TIN.
Yeah.
And not have the money flow back and forth and share the money. It's hard from a record keeping perspective. And at the end of the day, again, not a whole lot of guidance.
Right.
What HHS has told us is follow your accounting procedures, follow your accounting policies. Your financial records should match what you report on the portal. Well, if you get tricky with it or think you're trying to consolidate or make it easier, and they go to audit you and what you reported on the portal doesn't match your financial statements, where somebody could say, oh yeah, I think that could be problematic for you.
Yeah. Are you aware of any organizations that have been investigated, audited, reviewed at this point for monies that have been received, and the government is now looking into their application of those funds?
Not yet, but there was an additional FAQ that was just issued last month that said, look, the OIG is going to have ownership of this program. So if we have, potential, fraud, waste, and abuse of the funds. And so this is the example of the, physicians that said, hey, I'm the owner of this practice. I haven't paid myself. I'm just going to pocket this $120,000 and I'm going to take it as a distribution. Um, so, it's those types of situations, or the people that don't report at all, or the people that weren't open for business in 2020 but kept the money, or that had a change of ownership and didn't follow the rules. So I think it's those types of situations that they're going to go after, but I haven't seen any enforcement action yet. But what I always tell my clients, and we saw this with telemedicine, right? The government will give money and then they will take it away if they can. They will always
Absolutely.
find a way to go out and audit and claw it back. Look at the Medicare Trust Fund, right? It's not sustained.
No, it's insolvent.
Right. It's insolvent at this point. And so what do we see? We're seeing a lot of telemedicine audits.
That's right.
We're seeing a lot of takebacks. So we see this increase in audit activities. They're going to start the TPE audits again. So it's a way for the government to find the bad actors, make an example of them, but also to recoup some of that money.
Yeah. And, I'll tell you, it was interesting. I had a conversation with another attorney friend of mine just yesterday. In the last 3 months, we have been asked to engage on behalf of a dozen clients who have received civil investigative demands. Mm-hmm. I don't know, I've engaged in CIDs obviously over my career, also criminal investigative demands. But I will tell you that they usually don't come out in the frequency that we've been seeing them.
Right.
And it's almost like, it's almost like they were handing them out right now, like Halloween candy. The number of CIDs that we're seeing and the specificity on some of these for the narrow focus that they're taking on going after information from practices, it's unbelievable. And, where the OIG is being given carte blanche, to this thing, or carte blanche, I want to be careful so that I'm not using a French accent as I'm talking here. I want to be careful with that. Oh, stop it. I'm just having fun. And, here's the other thing. I have to get another chair. I keep finding myself sliding down in this thing. And, I've gotten out of my pajamas, which is usually the reason why I'm
sliding.
Sliding. But now I can't figure out why I'm sliding in this chair. But anyways, I'll have to figure that out later. So let me ask you, now that I've digressed, let me ask you, what have been some of the most challenging or some of the most difficult aspects for you and your clients in working through, this money that's been allocated to them?
A couple things. One is that clients are very frustrated that they've got to engage me, right? And they're like, man, I love you, but I don't want to talk to you as much as I do.
I got all this free money and now the money's gone and now I got to write a check out of my bank account on top of that.
Exactly. That's frustrating. And I feel their pain, and so they're like, we have to engage you. We have to engage our accountant, or we've got to pay someone to, to help us figure this out. I think that's really frustrating for them because this was supposed to be a no strings attached. And they're like, I've already done the PPP thing. I've gotten grants from the state. I've gotten donations locally. And this is just another thing that I have to report on. And oh, by the way, it's complicated. And oh, by the way, it's going to cost me money. So that's one thing. It's kind of like adding insult to injury. Right. The other thing is that the amount of information that the government is asking for on their portal is frustrating. So, and it doesn't matter how much money you got. Of course, if you received under $10,000, you don't have a duty to report, although maintain your records. But for someone who received $11,000 versus someone that received $11 million, you're basically reporting the same thing, right? So you're giving all of your corporate information over. You're giving your patient volume, your outpatient volume, your admissions, your everything. All of your employee information. Your revenues broken down by payer mix, broken down by quarter, and it's onersome and it's burdensome. And I know as the provider is larger, there's the data. There's just more data. But they're frustrated and they're like, what does this have to do with the provider relief funds? And I'm like, it has everything to do with data.
That's right.
So the third thing, and this is when clients really don't want to be talking to me, is they get the CID and it's very particular and it's like, wow, where did they come up with this data? And I'm like, the government has more data than we could ever imagine. And it's very hard to argue with, right?
That's
They
right.
know what you billed. They know what you received. So they're comparing, I think in my mind, I see this as comparing your financial records to your tax returns to what you're reporting in the portal to your patient care revenue. So they're looking, okay, where are they getting their revenue from? Patient care
Right.
services, rent, medical directorships, investments, comparing that to the volume information that you're reporting. And so I think they're looking at too, how are providers getting paid? Where's payment? Where's the payment? Per service payment. There's just a lot of data that they're going to be able to get and analyze, and they already had a lot.
Yeah.
That's frustrating, I think, to a lot of my clients as well.
It is. And let me go back to the point that you were making about enforcement of all of this stuff, right? With it being the Office of Inspector General. And you and I have an opportunity to get to work with a lot of wonderful people at OIG, really good people, special counsel,
Right.
investigators, different folks like that. But let's talk about some of the numbers, right? The total amount or the total funding amount for HHS COVID-19 awards that have been attested to as payments, folks, it's $282.5 billion as of today, November 11, 2021. Just think about that number. For a novel virus, $282.5 billion. And it breaks down as follows. There was $150 billion in COVID-19 awards that were distributed among 6 different public laws. Now, if you're a policy nerd like me and you're interested, you could take a look at Public Law 116-123 through Public Law 116-260 and also Public Law 117-2. And this will give you a breakdown of the $150 billion in HHS COVID-19 awards. Now, in the Provider Relief Fund that Amanda and I have been talking about, so far there's been $119.2 billion that's been actually allocated out of, I believe, Amanda, it's $186.5 billion.
Mm-hmm.
So, there's still some money there that they either haven't attested to or haven't reported on, but, there's still a significant amount of money that's left. Now, rural health clinics, folks, these are special designations that are provided to a healthcare practice in underserved rural areas, which are attributed to by the Centers for Medicare and Medicaid Services, right? And the federal government allocates payments to be distributed through the Rural Health Clinic COVID-19 Testing and Mitigation. So it's called the RHC Testing and Mitigation Program, which is part of the American Rescue Plan, the ARP Act of 2021, and through the Rural Health Clinic COVID-19 Testing, RHCCT program. $661.4 million has been allocated through that program. There's 2 public laws that you could look at here, Public Law 116-139 and Public Law 117-2, to help you understand better how the allocation of these funds have been distributed. And then there's also, which I find to be an incredible number, the Uninsured Relief Fund. This is an incredible number, $12.6 billion. And the COVID-19 claims reimbursement to healthcare providers and facilities for testing, treatment, and vaccine administration for the uninsured program providers reimbursement on a rolling basis. Keep in mind, this is a rolling basis. Directly eligible to healthcare entities for claims that are attributed to the testing, treatment, and/or vaccine administration of COVID-19 for uninsured individuals, $12.6 billion. We could obviously get into a discussion about the top states by award amounts and things like that, but you can folks, if you're interested in going out and doing some independent research on that, or if you want some of these numbers, feel free to reach out to me and I'll provide those to you. So, Amanda, this is obviously not the most sexy topic in the world to talk about, but it's a critically important topic. And I think when people start getting their CIDs in 2022, because it's going to happen.
It's going to happen. It's going to happen. Yeah.
People are going to be going, what do I do?
Right.
Well,
right.
There's a lot that I mean,
the biggest piece of advice I can give right now is that if you are billing HRSA under any of these programs, so this is the COVID-19 uninsured programs. If you're billing HRSA, do a self-audit. Call Sean, do a self-audit.
Don't call me right now. I am so backed up at this point right now with CIDs and criminal investigation. No,
seriously,
give me a call and give me a call. And if there's something that I can do to help advise, well, I can't advise, but if I can help guide you to finding the right person or persons to be able to help you, I'll definitely do that. And, again, to Amanda's point, healthcare is a very small community. Believe it or not, we're a very small community. And the people that do the kind of work that we do, we're very closely knitted together and we collaborate with each other. We support each other, and we do it because we're physician advocates. We do it because we want to mitigate risk for hospitals, health systems, RHCs, any type of facility that's receiving funding or payments for services from the federal payer programs and or from commercial programs, to make sure that you're provided a level playing field and that you're afforded due process. Because as we talk about it all the time in healthcare, unfortunately, the healthcare system doesn't seem, or the legal system in healthcare doesn't seem to follow what the judicial system was established to do, which is that all individuals are presumed innocent until found guilty by a jury of their peers or by a judge sitting on a bench. And in healthcare, you're guilty until you can prove yourself innocent. And that's a hard pill to swallow.
Hard. Right.
So if we can, let's go ahead and wrap this up. Let's just quickly talk about the two deadlines. So tomorrow we have the very first deadline, which is what?
Which is the reconsideration. So under the Provider Relief Fund program, if you received funds under phase 3, so phase 3 would have been an application that you would have filed in October or November. So you would have received funds probably in December or January. If you think that you received funds in error, so you should have received more than what you did, you have the right to request a reconsideration, and that's due tomorrow. So the HHS published the methodologies as to how they awarded money under phase 3. And it varies based on, provider type and the money that was available. So you're not going to be able to appeal the methodology. So the methodology is set in stone. But if you think that they applied the methodology incorrectly to the financial data that you submitted, then you have a right to request a reconsideration, and that's due tomorrow.
All right. So that's the first of the deadlines. The second one isn't really a deadline. It's just the end of the grace period. So can you talk about the November 30th deadline?
Yeah, so November 30th, that is the end of the grace period for period 1 reporting. So recall that period 1 is your use period from January 1st, 2020 until June 30th, 2021. So it's that 18-month period. So you must have completed all of your reporting through the portal by midnight on November 30th. There will not be any further extensions, so please know that. And then if you owe money back, you have until December 30th to pay the money back. So after you go and you report, it's going to tell you, yes, you used up all your funds, or no, this is the amount that you're going to have to repay. And so you have 30 days after November 30th, so through December 30th, to pay that money back. And you do that electronically online through the HHS website.
And is that through the reporting portal that they have?
It's actually a separate. You don't pay the money back through the portal. It's actually a separate. It's a separate website, but it's through HHS.
Okay, and the portal that's out there for reporting. Can you talk a little bit about that?
Sure. So the portal, so if you have to report and November 30th is your deadline, hopefully you're already registered for the portal, because the deadline was actually September 30th. So you should already be registered. For every EIN that you're reporting for, you have to have a unique email address and to be able to get on and report. So the reporting portal, it's actually, I've helped a couple clients. I haven't gone in and actually done the reporting, but they've shared their screen with me and I was able to help them walk through it. Once you've got all your data together and all your information, it's relatively easy to go through and put it in. There were some glitches in the beginning, which is why we have the grace period. And I think those have largely been, fixed, some computer glitches. So it's once you get all the data, it's relatively easy to go on and just put it in. A lot of the calculations are done for you.
Good deal. All right. Well, so look, folks, even though we have been going through this now for a couple of years, there's still so much that we expect. We're going to see more guidance coming down the pipeline from those in elected positions. I think they're still trying to figure out what they need to do as well. Again, I think, do your diligence, understand what you've been paid, understand how you've allocated this money. Where is it gone? How have you, record kept for those expenses and those allocations that you have made of these funds? Don't sit back and think that, oh, I'm just a solo provider in the middle of nowhere. Nobody's going to be interested in my $11,000. Guess again. This is all data. This is data driven. The same way that they make a determination on who they're going to focus on for an audit is data mining. And that's what they're going to do. They're not simply going to look at the individuals that received $1 million or $11 million. It's all individuals that receive governmental funding or subject to review. And it's not a matter of if they audit you. It's just a matter of when. And knowing that the Office of Inspector General has been given the enforcement authority over this thing, and knowing how the Office of Inspector General publishes a list every single year of the things that CMS failed to enact or failed to take under advisement or carry out at the behest of the Office of Inspector General, they will take on these things themselves. Folks, we have an insolvent program. Our trust fund is not going to sustain. I think the latest number is 2026, if I'm not mistaken.
Right. Mm-hmm.
Pay attention to what's going on. Do your part. And if you run into a problem, please reach out to me, reach out to Amanda, reach out to your general counsel, your outside counsel, your tax professional, and get guidance on this stuff. And don't wait until you receive a CID or some other type of subpoena for information, because then it's mostly too late to try to put this thing together because of how complex it really is. So this brings me to the end of today's session of the Compliance Guy Live. I want to thank my very special guest and my really good friend, Amanda Waesch, for taking time out of what I know is an extremely busy schedule. The truth is, right before we got on here, we were actually doing a pre-hearing review of home health stuff. And, for you to drop what you were doing, this is my job, so I have to be here. But for you to drop what you were doing and to come on and share your knowledge and your information with all of the listeners that I have for this program, the viewers, and I know we're going to have a lot more, on the recorded sessions and the podcasts who will be tuning in. Again, for those of you that have questions or comments or concerns, please don't hesitate to reach out to Amanda and myself. We'll do our best to answer all of these questions and concerns, and we'll get back to you as quickly as we can. Again, on behalf of the entire Compliance Guy Live crew, myself, and again, my very special guest, Amanda Waesch, thank you all so much for tuning in, logging on, and hanging out with us on this short, condensed version of today's show. Don't forget, You can submit this for consideration of up to 1 CEU. So take advantage of that. And again, until next time, be good to yourself, but more importantly, be good to each other. Take care.